Okay. We're doing a case of mononucleosis. Remember, mononucleosis is a misnomer. And the cells that are going to be of interest here are going to be lymphocytes, reactive lymphocytes. They are not monocytes. And I'm going to try to show this example as something for you guys to learn more about differentiation of lymphocytes and monocytes. Remember, not easy. If it was easy, mononucleosis would be not called mononucleosis. It's called mononucleosis because the first person, who was probably a better scientist than all of us together, including me, when they were looking in the microscope, initially they thought those were monocytes. Again, we are going to be looking, and every time we're looking around, you are counting 100 cells, but you're taking a look also at the red blood cell line and the platelets. Here you can see the number of platelets pretty good. Red blood cells, they all look basically same size, but we don't know if they're big or small, because to know if they're big and small, we really need a reference point, and for that we need a mature lymphocyte. So let's go. Our goal is 100 cells. Let's start. Neutrophil, neutrophil, neutrophil. Monocyte. How do I know it's a monocyte? It's gray. The nucleus is very homogeneous. There is no polka dots in there. There's no freckles. And the nucleus is folded on itself. It has a grayish prevalence color. The cells around it are not pressing. And if they are, they're not causing that cytoplasm to show blue. Neutrophil. Lymphocyte, look, that's a mature lymphocyte. That's one we can actually use for a reference. We actually want to see if the RBCs around are about the size of this mature lymphocyte nucleus, and they are. So I'm saying that those cells are basically normocytic and normochromic. Did you count the lymphocyte? No, I didn't. Let me count it. This is a lymphocyte that is reactive, and the other one is a blob of state. So I'm looking at the cell that has a cytoplasm. That cytoplasm is not gray. It's transparent for most of it, and it has a bluish tint, especially on the areas where the RBCs are pressing around it. Okay? Neutrophil. Lymphocyte reactive. This one easy to see what I'm talking about. When you made this smear, this RBCs pressed around that cytoplasm. The cytoplasm on the reactive lymphocyte is so very pliable that the cells around it push against it, and the protein antibodies that were in the cytoplasm get squished together and show that increased hue of blue where in these areas, because the protein of concentration is a little bit higher where the cell got squished. This is another lymphocyte and a neutrophil. lymphocyte, lymphocyte, reactive. I'm gonna call it reactive because I can see that cytoplasm is already growing. It's already demonstrating that there is an increased protein production in here. And that's exactly what a reactive lymphocyte is. Sometimes you can see reactive lymphocytes are so reactive that you can see nucleoli. Why would you see nucleoli? You see nucleoli because it's a cell that's devoted in producing protein, and if you need to produce more protein, you need to produce more ribosomes. How you do that? Nucleoli. So this is a neutrophil. Neutrophil, lymphocyte. Yes, going towards being reactive. Lymphocyte, neutrophil, lymphocyte, neutrophil, this is a neutrophil that I'm going to make a special consideration. I want to talk a little bit about it because this neutrophil has an important characteristic. The nucleus does not have a full indentation where it segments it in more than one piece. It's only one continuous nucleus. That is a band. So we counted that as a band neutrophil. Lymphocyte, lymphocyte reactive, globular one nucleus. The chromatin is a bit less organized and less condensed than you see normally in lymphocytes, because this is a cell that's producing protein. Cells that are producing protein have cytoplasms that are less condensed. This neutrophil, you can see the cytoplasm is pretty condensed. See how tight wounded those chromosomes are. Neutrophil, take a look at those platelets. Platelets are pretty. Good number. Lymphocyte. Lymphocyte again, reactive and reactive. Aha, look at this. This is, yeah, that's a nice one for you guys to see. This is a basophil. A basophil has dark granules, black granules. And the granules are superposed over the nucleus. Sometimes you see a whole bunch of granules, so many that you cannot see the nucleus because they superpose the nucleus so intensely that you don't see the nucleus underneath it. But in this case, you have a much less dense number of granulation, but you can still see it superposed, and you can see still big, beaded nucleus, a basophil. Mature lymphocyte, condensed chromatin, you can see the clumps. Two lymphocytes, one reacted, one not. Neutrophil, monocyte, let's put that right and center. The nucleus is lacy, airy. It's not that the chromatin is not condensed because the cell is immature. It's just how airy and lacy it is. And the cytoplasm is grayish. And if you look very intensively, it has some granules. There are very, very sandy granules. Not pink. Pink granules you can sometimes see on a lymphocyte. On a monocyte, you see almost like like sand underneath. Neutrophil. Lymphocyte, and it's reactive. Sorry, was trying to center the neutrophil. I think it's another neutrophil, but we're gonna count this one. Monocyte. Neutrophil. Lymphocyte reactive. Trying to center it for you guys. Neutrophil, I'm not gonna count that as a band because it's a little bit thinner, and I'm gonna explain to you guys why you don't count as a band. Theoretically, you could say it's a band, but I try to be a little bit conservative, and if it's thin enough, I will probably side it with segmented. It's almost there, I'll count it as at there. Always try to, if you have to err, because it's a continuous, it's evolution. In the continuous, you're going to have to find where you are in this continuum and always go towards the most mature cell. Because if you start saying, talk too much about bands and they are already more mature, you end up with a patient with going for a appendectomy that doesn't need the appendix being removed, but the doctor saw all those bands and got scared and sent the patient for surgery. So, neutrophil. Neutrophil, mature lymphocyte. Neutrophil. Sorry, couldn't stop. Neutrophil. It's very difficult to get the lymphocyte reactive. It's pretty difficult to get the flow to be continuous. This neutrophil. This is like very scratched. Guys, this is so squished, I cannot get it in focus. It's a monocyte. Lymphocyte reactive. Blue The other one was gray. Another one of those band-like. You see, this patient has mononucleosis, so they're probably very sick. You probably see more neutrophils being on the young side, lymphocyte. But I'm gonna be very judicious. So far, lymphocyte. Cytoplasm is pretty dense. Nucleus is much denser. It's less lacy than the other one. It's pretty round, and the cytoplasm has the blue stains. Lymphocyte. That's another basophil. It's not a good example of a basophil, but you still can see, if I go very slow, you can see that the granules are superposed and that the nucleus is an L shape, S-shaped. Lymphocyte. Lymphocyte. Neutrophil. 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 Lymphocyte, neutrophil. Neutrophil. Lymphocyte. It's getting to be too sparse. Let's go to Goldilocks area. Neutrophil. 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 Neutrophil monocyte. Nucleus is folding in itself. I need the area that's not so. I'm going another area because this is so scratched. Lymphocyte. Lymphocyte. Lymphocyte, neutrophil. Lymphocyte. Lymphocyte, lymphocyte. Neutrophil, lymphocyte. 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 Big glob of stain, lymphocyte. Neutrophil. Neutrophil. I'm gonna call it a band. because it's very much more continuous. It's a older looking band. It's more on the mature side of being a band, but it's a band. Neutrophil. Another band, a neutrophil, lymphocyte, reactive, cytoplasm is blue, especially on the outside of the membrane, the outside of the cytoplasm. You see a greater condensation of protein. Neutrophil, lymphocyte, neutrophil, monocyte is a monocyte. It's strictly lymphocyte. Oh my gosh. Let me try to find an area that's less scratched. Eosinophil for the 100 cell. Aviator glass. Very typical aviator glass nucleus. And if you look, I really need, the color saturation is much less orange on the video than it is on the microscope. But I'm gonna try to go around and move it. Remember, when you're looking at a cell, you're trying to find a three-dimensional thing, you need to have depth. How do you find depth? You have to go in and out of focus for you to actually have an idea, a three-dimensional view of the cell instead of a two-dimensional view. So if I only give you this view, that's two-dimensional, right? But if I go like this, I take you in and out of the field, you can actually, if you look very closely, you can see that the granules that you're looking at are much bigger, much more like a bead than they are like grain of sand. But for you to have an idea of that globular, three-dimensional, looking at as little balls, you had to go in and out so you can actually have some depth perception. Because without that, see, it's not three-dimensional, you're not going to be able to see it. So we did 100 cells, we look at the RBCs, we look at the platelets. Some of these, some of those dots in here on top right now in this field are actually stain precipitate. They're not platelets. You have platelets in the field, and platelets, remember, they are their structure, they actually have membranes, they have granules. And you have to see, and they are at the same level as the RBCs. They stain, it's actually on top of it. It's almost like there's two levels of this field. And actually I'm wanting to talk a little bit about this, because to see where in the microscope, where in which field you are looking at, if something is on top of the slide, like this is dirt on top of the slide, and then you look where the RBCs are, the platelets are at that same level. That stain precipitation, this artifact is common enough that you guys need to learn how to differentiate. Because any person that does not know that this is a common occurrence in the laboratory would look at this slide and say, oh, look, there's so many platelets. This person has thrombocytosis, and this person does not have thrombocytosis. There's two levels of little dots that you're seeing here. The platelets in here are at the same level. There is like 1, 2, 3, 4, 5, 6. I'm seeing 6 platelets, maybe 7 in this field. All the other dots in here, let me see, count again. 1, 2, 3, 4, 5, 6, 7. I see 7 platelets in this field. 8 platelets. All the other dots are actually not at the same level as the cell. When I go in and out, you can see who is at the same level as the cell and who's actually on top of it. Important for you guys to see this because this is pretty common, and I don't want you guys to go around calling thrombocytosis when there isn't. Okay, guys, this is mononucleosis, and I'm going to be posting this for you.